Dr. Michel Odont calls it a nocebo effect, where you put in lots of fears of lots of random possibilities into a woman, and that actually creates complications. Their blood pressure goes really high when they go to the appointment, and when they check their BP at home, when they are more relaxed, it comes out normal.
This is the Birth Agni podcast, the fire that brings us alive, that burns myths and opens a channel of authentic natural birth stories. This show debunks the many myths of the medicalized births, showcases the plethora of choices a pregnant couple can make to embark on their empowered birth journey. I'm Divya Kapoor, a certified birth and lactation counselor and an aspiring traditional birth attendant. Let's get the flames blazing high. This series is called the Birth Better series. It is the second of our episodes with Tapasya.choudhary, a traditional birth attendant and doula. Creating your birth space is about creating an environment, both physical and emotional, that lets your labor progress and unfold as naturally as possible. What does that mean? Let us dive into it. Tapasya, we're going to discuss today creating our birth space, and we spoke at length about how fear is propagated in the social media everywhere about birth and how we should actually approach it. And today I wanted to also kind of speak about the fear that comes in with every little thing in pregnancy. So a mother goes for her regular checkups. Her weight is put in a box. Oh, you know, your weight may be a problem. Your height may be a problem, or you're too petite. That may be a problem. So a lot of issues are attached to her pregnancy. That also, in a way, is fear, and not in a way, it is fear. And how does that kind of affect your pregnancy? And thereon, like we'll go about. What is birth space and how that should be created. But before that, I wanted you to talk about this.
Okay. So if we see a pregnant woman, maybe a first time mom, they have this inbuilt fear that will everything go fine? That fear is there naturally, and that fear kind of is needed. The nature had made it, because then we take better care of ourselves, and then we protect ourselves from different things, etc. But the fear that is coming from outside is what creates problems most of the times. And as the pregnancy goes towards the end, towards the labor, I've seen moms go fearless most of the times. I've seen moms say, I know nothing will happen, but whatever happens, I'm not going to the hospital. I am going to have my baby where I want. But the fear that system puts in them, because again, Dr. Michel Odont calls it a nocebo effect, where you put in lots of fears of lots of random possibilities into a woman, and that actually creates complications. So
Yeah.
he talks at length about gestational diabetes, that doctors put in so much fear about gestational diabetes. Your baby will be too big, you will be diabetic for life, this and that. But first of all, they should explain that placenta secretes hormones that inhibits insulin, that creates insulin resistance, because baby needs glucose 24 hours. So if we don't explain this and just tell what bad outcomes can happen, obviously the woman gets all the signals that, oh my god, I don't have.
And something is not right. Whereas this is actually a physiological part of your pregnancy, where things are not really in a standard because everybody responds very differently.
Yeah. Similarly, when it comes to hemoglobin, like your hemoglobin is supposed to go down in last few weeks of pregnancy, okay? It cannot be above 11 or even 10.5. I've rarely seen, because your blood volume is increasing at 28 weeks. Your red blood cells are increasing only 30%, and your plasma volume is increasing more. So it's like you are adding more milk to the coffee, so it will dilute, obviously. So just like that, it's called physiological hemodilution. But without explaining this, or without considering this as a fact, women are given out, iron infusions, this and that, and lots of fear that you will bleed out in death. What are we doing? And again, in the prenatal appointments, many women observe that their blood pressure goes really high when they go to the appointment, and when they check their BP at home, when they are more relaxed, it comes out normal. Sometimes we call it white coat syndrome, that when we see a doctor, we generally have this fear that, is everything okay?
Yeah. You and I spoke about this also very recently with one of my mothers who'd go to the hospital, have her blood pressure increase, and then it was at home it wasn't as much, but the variation was too high in the too different rather than same high in the hospital.
When I remember myself, like I was carrying twins. I was living in a place where I didn't have my own vehicle. I used to go by public transport and reach my appointment somehow, with that heavy body running there. And immediately in 5 minutes, the nurse would take my blood pressure. I mean, come on, just allow me to breathe, have my glass of water, etc. And she would be like, oh, doctor's not going to like this blood pressure. And she herself used to say, I'll take it
Yeah,
in some after a few minutes, and then it would come normal.
yeah,
So all this affects how mothers look at the pregnancy, and especially if you have conceived through IVF or assisted reproductive techniques, or you have had previous losses, or you have had a history of miscarriage or a stillbirth or something. The fear is manifold, because the medical system tells you that you are at certain risk of having it again, instead of telling them that every pregnancy is different, and we can treat it differently. You can look at your pregnancy in more positive way. So that's where the fear comes from. It is related to pregnancy, but it is a different ball game, because all throughout the pregnancy, one of the family members is there at your appointments, and he or she is also listening to what doctor is saying, and that person is also carrying that fear at home, and the fear is kind of getting multiplied, that, oh, something might happen, oh, this is a precious baby. Yeah, kind of.
yeah. Also, sometimes I don't understand when you're talking to a mother, all that you're actually putting in your head is you thinking aloud, right? You could just let it be. And when there is actually a pathological issue, then you are supposed to inform her that this is how it is, this is how we assume it should be, and maybe, this might be a problem. But at least reach where it is pathological and don't just think aloud in front of a mother. We are detaching the emotional aspect of pregnancy absolutely in this entire process and think it's a physical thing and only thinking about ourselves as care providers in that case, of
Yeah,
course.
yeah. What you're saying is pretty natural, because sometimes even even midwives, even when I am talking to a person, obviously in my head, possibilities are springing. Just yesterday I was talking to a twin mom, and I don't know why I said that if the second baby is breech, these are the scenarios. Obviously I have to make it clear that how a twin birth goes. But then I thought to myself, why did I put that fear in her that second baby might be breech? I don't know. I mean, these are very subtle nuances, but we have to be very careful what we are saying to a pregnant woman. And in our culture, in our society, we try to bombard a pregnant woman with negative birth stories. You know what happened in that birth, and this and that, and with emergencies. And what I tell my clients is that create this bubble. Don't tell your birth plans to anybody, and if anybody starts telling you horror stories, tell them, please stop, I don't want to listen to it. If you have something positive to tell me, then do. Otherwise, I thank you.
Yeah. And it's very common. It's very, very common. If you want a normal delivery, somehow people around you would start questioning, would start telling you, oh, what went wrong in all the people who wanted a normal delivery. Everybody is just trying to sell their story to you, their opinion to
Yeah,
you.
there is a very wonderful podcast on this, particularly what you said of Marin Green in her podcast series Taking Back Birth. And I just love that podcast where she says, how we change the stories, because most of the stories that have been told were created emergencies because of the management of birth, the medical management of birth. And nobody explains this to a woman, that if what magic happens in a physiological birth when you are allowed to give birth without interventions.
Yeah. Most of the times, mothers are just trying to tick off, I hope this is right, this goes right, instead of seeing that, oh, everything is beautiful. And when I'll come out of it, I'll be able to be there, be euphoric, which she has a sense of course. Just saying it in general. Every mother has that sense. So just to, put her in a process where she's supposed to take, and then go through it and not feel what she's feeling. So that puts her on a very different wheel altogether. And how does
And
that
again,
affect you?
seeing, we are in the system, we are treating the paper rather than treating the human being.
That's a line should be hung on the board and pinned on the wall.
We are looking at the reports and we are seeing, where we are telling her what is wrong with her body, but we are not asking her, how are you feeling, what is your intuition, have you talked to your baby, have you just sat down in a place, have tried breathing calmly and asking yourself, am I all right?
The spiritual aspect is never really explored. That's what it is in a physiological birth. So Tapasya, I wanted to, from here, take it to how does this now, this fear, and the mother goes into labor, the contractions have started, and she is to deliver. How does then the cocktail of hormones and fears doesn't help the process, and how else the process can be improved? How does that work?
Well, the cocktail of hormones, what you say, is a very long process to explain, but it's very interesting that your brain is releasing lots of oxytocin, your pituitary gland, and oxytocin is making your uterus contract, expand and release, and reduce in size, force down the baby. And other hormones, they are working in a harmony to make the process of labor bearable for the woman.
Yeah.
And she remembers the contraction, the pain of the contraction, only during that contraction. Next contraction, she doesn't remember actual intensity of the contraction, but she's anticipating the other one. So once a contraction ends, the endorphins are released. In a similar way, when we work out a lot in the gym or we run a lot, we are exhausted, but we are feeling good, we are feeling this sense of achievement. That mechanism kicks in really fast, and that is how we take one contraction at a time, and n numbers of contractions till the baby is born. And when the baby is in the birth canal, the body knows that now baby cannot stay there for very long, so it needs to push it down, push it out. So again, the adrenaline rushes in, which is the flight and fight hormone, which helps the mom push out that baby when the baby needs to come out. And that adrenaline itself helps the mom and the baby to be more alert when they are seeing each other for the first time, because baby cannot be just drowsy. The baby needs to be alert to see the mom, make that eye contact, smell the mom, and the bonding. It's a beautiful process in which mom and the baby are falling in love with each other.
Yeah.
So all that is happening. And I have seen that fear play most part in the pregnancy and before the beginning of the labor in mom. Once the labor starts and she's focused more on the pain part, if she's left alone, the fear is taken care of by all these cocktail of hormones naturally.
That's when she's undisturbed.
Exactly. But in a hospital setting where she is listening to lots of noise of the gadgets that are monitoring the baby, this and that, the smells of the hospital, the face of the doctor, the face of the nurses, and the scared faces of the relatives who have accompanied her in the hospital. I don't know. One, I remember one doctor saying, "Baby will suffocate," and I was like, "How?" I asked that, even in labor, they are not looking at the mom how she's doing, but rather they are more interested in looking at the D cells, the heartbeats. Obviously you should monitor the mom, the aspect of safety is important to a certain level, and monitoring again is the routine procedure, and it's okay to a certain level. But when it starts affecting the mom, it starts, putting the fear into the relatives, what is going to happen, when is the baby going to come out, is the baby okay. When that starts happening, the doctor should be perceptive enough to say that, all right, we will just, stop all this and let the mom labor and let's see how it goes. But instead of that, we are always in a hurry to wrap up the birth.
And also how everybody kind of is the fetal heart rate and maybe just assessing whatever they're assessing instead of just quietly writing it down and going out of the room and discussing if they at all have to. Everybody on her head is discussing all of this and she's listening. So many mothers, including myself. And that had an impression on how I was taking my labor and how I was assuming the entire process would be.
Also, nobody sees births every day, so you are not seeing what is normal in a labor. So sometimes I have seen partners say me, "Oh, she's vomiting violently." Yes, that is part of labor. That means her cervix is dilating. It's a good sign. And when they know that beforehand, they don't panic.
Education
Oh,
here is,
she's
yeah,
exactly.
so crucial.
Oh, she's bleeding. And when I hear on the phone, she's bleeding. And then they send me a photograph, picture of, mucus plug having some blood stains. I'm like, this is perfectly normal. So when we educate beforehand, this, sudden panic, oh, this is happening, oh, she's sleeping in between contractions, how she will, because this is again propagated by the medical system that a woman
Yes,
should not sleep between contractions, as if she's a machine, producing contractions over contractions. Come on,
absolutely.
she can and she does absolutely naturally sleep in between contractions, and one should let her relax as much as she can. Even in between pushes, she needs time. But we have this culture of, once the hairline is seen, get the baby out,
My
So,
mother slept. My mother slept. She was living my brother, 4 kgs, two cords around the neck. Absolutely normal. And she was so tired. She's like, I'm sleeping. And then she slept. She slept and woke up, and
exactly.
then the baby was born. So, Tapasya, how does this affect now all of these interventions, as we say, that creates fear in the mother, which is not required? How does that affect her labor?
She feels, am I capable? Because already she is in a vulnerable state. She's, trying to find a way to make herself comfortable during that pain. Fear is a very clever emotion. It creeps in from everywhere. From the little crevices you give, the fear creeps in. So that then affects her confidence, that will I be able to give birth? Do I need help? Then she doesn't know how to take a decision because her brain is not wired to take decisions. Her brain is wired now to, the process of labor has started. Now I have to take it to the end and I'm doing my thing. I don't know how to process all these stimuli that are coming from outside. And that, you know Michelot don't, again, I mean, he's a venerable. He has said some golden words. So he says that inhibition of neocortical activity in labor is a natural thing, and we should let it be that way.
Yeah.
So he's like, if the mother is thinking too much, give her a glass of wine or a glass of champagne
And
and
that was
let her
used
relax.
early in the early days. Wine was used.
Exactly. So now we are using much dangerous cocktail of, morphine and lots of anesthetic drugs. But I used to work with lots of Argentine clients who used to take a joint, and this is natural medicine. This is, calming you and taking you to a different realm. And if you need it in labor, that's fine. It does not affect the baby as The drugs that you are using in labor and birth, they are affecting the baby in a very bad way. We don't even know that. There is not even enough research on that, because nobody's going to fund that research, because the pharma companies do not.
Yeah, business
uh,
involved in everything.
yeah, inhibiting the logical thinking rational brain is very very important for the labor to progress, and we don't let it be that by introducing lots of fears and possibilities and hypotheses. And that is not even needed. Just look at the mom. If she's doing fine, where, and you monitor her occasionally, and if the baby is sounding fine, let her be, and let her partner be, and let that family be. Counsel them that okay, it will take time, whatever it takes time. I mean, there is no shortcuts in labor.
Right. It also kind of slows down the process, right?
Yeah,
So, the way we give the cow analogy, where if a cow kind of in labor, she's found a very private space where she can go inward, and then she sees a lion or even hears the lion, smells the lion, her body is gonna temporarily stop contracting, and then she'll find a new space, because that's a fight and flight mechanism that is kicked in. And the body is smart, it's a defense mechanism. It will slow down the labor so she can go find a new space, go inward, sit with herself, and then again the labor starts again, it takes on again.
exactly. I just want to share one thing that I do with my clients, that in the few last few prenatal visits where I just go home to make myself familiar with the birth space, etc. What we do is we hold hands. The people, whoever is attending the birth, we hold hand, and we do this meditation of creating a safe birth space, where
Wow.
we are putting our energies in manifesting that we are welcoming our baby in harmony, in love, and in safety. So just before you admit the person, just the nurses, the husband, the doctor, the mother, they can just stay calm for a while and do this. I mean, it's not rocket science. Again, all the time we have been talking about fears, but about tackling them, there are so many parts. Educating your family about how birth goes, what is natural, what is not, informing yourself what goes on in hospitals, and what are the routine interventions, and how I either deny them or use them depending on the situation. This kind of knowledge in the birth team, not only the mother, because mothers should not have to be fighting for their rights and their choices in the hospitals.
And by
But
birth team, the husband in the family.
exactly. So all of us uh, can make the birth space more joyous, rather than putting in all our personal fears. It's not very difficult. It is doable. And I'm not saying that fearless beautiful births happen only at home, although that has been my experience. But they are very doable in hospital. There are so many aspects of fear, but there are so many aspects of fighting with the fear and creating a safe bubble around you to to gestate your baby and to give birth the way you want.
Yes, I wanted to also, speak about how do we create that birth space in terms of physical, the basic physical aspects, just dimming the lights, having good music on, things on those lines. Would you elaborate on those lines?
Obviously, a mom would want to do things really differently than the system is designed to support her. In home births, why people choose home birth? Because they want to labor in peace. They want to have their own music. They want to eat their own food. They want to be in their own clothes. So in hospitals, also, with the help of your doula, with your partner, you can do that. Create your safe space. You can say, please leave us alone for some time, will you? Like, not allowing the nurses, the doctors, checking on you all the time. You can say no to frequent vaginal checks. We can put in our own music. We can be in our own clothes. We don't have to wear those hospital gowns. That's not mandatory. Obviously, we can say no to interventions, like as soon as you go, they are going to put a hep lock in you for the possible IV. It is
Yeah.
painful, it is uncomfortable. Why do I allow it if there is no emergency?
We associate subconsciously it to sickness.
With fear. Because from childhood needles are associated with fear. If you do this, I'll take you to the doctor uncle and he will give you a big injection. That kind of
All our life. Yeah.
association is always there all our life. So all these things we can easily avoid and create a positive birth space. If the outside thing is not happening, outside environment is not conducive, many women just, they want to do their own chanting, they want to put on their headphones and listen to, hypnobirthing affirmations. This, so many things can be done. The husband can be told beforehand that you are my rock solid support, do not waver. So, be informed, educate yourself, and let's be clear on what we want in our birth and what we don't want. So that if the doctor suddenly comes and says something, we can at least say, give us some time to think.
That empowerment through education also takes time. So it's something you'll invest in for a good time in your pregnancy, because everything about birth takes on your own experiences in life, where you've been and how you tackle your own life issues, all that kind of. When you figure that out, that becomes a coping mechanism.
Yeah, the way you live your life, the way you birth.
This conversation extrapolates into nurturing the mother or her birth space, which is our next episode. There is a field beyond fear, where the body is empowered to take on labor and birth. To land there, it is crucial to take birth education. To enroll into our unique labor and birth preparation course, reach out to us at www.birthagni.com or scroll through all available prenatal and postnatal preparation classes. Thank you for listening, all in the spirit of birth, womanhood, and freedom. Remember, you got the power. This podcast is about physiological birth and does not offer or claim to provide medical knowledge or diagnosis.